keeping your attention to the breath. When we experience in wandering mind, acknowledge where it went to, then bringing it back to the breath. Your mind may wander 100 times. Your duty is bringing it back to the breath 100 times. Breathing in, breathing out. Now, as we are coming to the end of this short practice, I would like to invite you to pay your attention to the outside world. Whatever you are experiencing right now, whatever you are hearing right now, just noticing it coming out of this short practice. Again, being aware of what's happening around you. Okay, now just opening your eyes gently when you are ready, taking your time. Venerable Mahasangha, dear students and the friends in Dhamma, today we started our seminar with a short practice, and I would like to start my session saying congratulations to Dr. Sarat Chandrasekhara and his colleagues and everyone at SIBA for their recognition of the volunteering work that run by SIBA. So I heard that they were honored by and recognized by United Nations volunteering sector. It's a great achievement and appreciation of your hard work. So as a Sri Lankan educational institute, your focus was not only just the teaching and learning practice, but also for outsiders, not only for your own students and staff, the well-being of your own staff members and the students, but teachers, prisoners, and all walks of life. I heard that you have been running more than 63 volunteering projects, whole country. So it is wonderful, amazing achievement. Congratulations to you all. Today, as Dr. Chandrasekhara mentioned, I'm so glad to be here for the second time. Many years ago, I was invited to your university to conduct a session on Mbct, stands for Mindfulness-Based Cognitive Therapy for Depression. I was there with some of our colleagues that we work at the Glasgow Mindfulness Center. Dr. Alistair Wilson was the consultant psychiatric during that time. And we visited and we conduct a practical session. So thank you very much, just recalling those, that's wonderful memory and the great experience. And some students are still keep in touch with us. Therefore, Assistant Professor Sarat Chandrasekara's work and with his colleagues and everyone, as far as I remember, when we at the University of Peradeniya, we did quite a lot of work for the students and the community during that time. I'm so glad to see it. Still his energy is there. So which I saw in 20 years ago. Still I can remember when I say Saracha Chandrasekhar, I can remember his beautiful handwriting. So you all are students. I'm just addressing the students. You all are so lucky to have him and also the other staff members, his leadership and his kindness, compassion. Also is eager. So whatever he wanted to teach you and his experience and studying as a psychology student, I can remember not only in that area, but also in the Buddhist philosophy and sociology. There are quite a lot areas he studied. So I'm glad he's sharing that knowledge and also inviting us to join you. Therefore, it's great joy here. With great joy, I'm starting my talk today, saying thank you to him and everyone who invited me today. So I would like to have, like when you are delivering a talk, we say, what are the learning intentions? So I have divided my talk into 4 categories, like the 4 sections. So my learning intentions are today, or even teaching. So you are going to learn and I'm going to teach, but at the same time, we all are going to learn something. Therefore, the first one, what is secular mindfulness? Today's talk is mindfulness and counseling. That is the way how the university advertised this talk, mindfulness and counseling. Really nice 2 keywords. Also, this is being conducted by the Department of Counseling Psychology of Sri Lanka International Buddhist Academy. So that particular department of counseling and psychology. So which is another good area. So counseling psychology in the West, we have so many schools of counseling, as you are already aware of, like humanistic and behavioral therapy, and there are various counseling schools. So I'm not going to talk about those schools and the connection with mindfulness, but the first section of this talk, I would like to talk about what is secular mindfulness. Why the secular mindfulness? Why we use the word secular? So I think maybe for some people that can be a new word, secular, for those whose first language is Sinhala. Secular is, the translation is, there is no religious concept without a religious practice. ඒ කියන්නේ ආගමික පැත්තක් නැහැ. Mindfulness කියන්නේ සතිමත්කම. ඒ සතිමත්කම අපි සතිපට්ඨානය කියලා කියනවා. So satipatthana is the Pali word for mindfulness, but some scholars say that is exactly not the same. So satipatthana has different deep meaning when we translate into mindfulness. In the West, mindfulness is just paying your attention, being aware, and just noticing whatever you are experiencing without judging it. So those are some of the definition for mindfulness. So then what is secular mindfulness? So that's something very popular in the West. So that's the first one I'm going to talk about. The second thing, how it works in the West, how the secular mindfulness we use in the West, especially in healthcare, education, and different social, at work, in the professional life, personal life, in different areas, how we use in the West. And also the third part is mindfulness in counseling. So counseling is a popular, well-used psychotherapy in the West. So last 10 years, they have been using or integrating mindful skills into professional counseling. So I'm going to share a little bit my experience in that area too. And then the fourth thing, how to use it in the practice. In other words, integrating mindfulness as self-care into counseling and psychotherapy training. I think that is the most important part of your life as students, as teachers. So those are the 4 sections that I'm going to cover during my talk. Also, at the end of the talk, you are very welcome to ask any question, maybe half an hour we can have for the question and answer time. The first one, as I was explaining you before, what is secular mindfulness? So Satipatthana in Pali language, Satya, Satimatkama, Sprutiya, whatever the word we use for that, is for you. So meditation, Satipatthana Bhavanava, from Mahasatipatthana Sutta. Satipatthana Bhavanava, like you can see here my background, you have the statue of Buddha and the beautiful flowers, and also 3 candles. When you go to a temple and you pay your homage to Buddha, Dhamma, and Sangha, you bow to the Buddha, or you bow to it if there's a monk, you pay your respect as Buddhist practitioners. Then you may sit with cross-legged, and before that you may have some incense and candles or some offerings. If it is in the evening, if you are going to start 7 o'clock, you may have prepared some herbal drinks, Vilampasa Pujava. So then we, after observing 5 precepts and Buddha Vandana, then we say Tipiso Swakato Supatipanno, paying homage to Buddha, Dhamma, and Sangha. Then just following the monk's instructions, or maybe if you are doing it by yourself, then you practice mindfulness, having a supreme goal. What's your supreme goal when you are practicing Satipatthana, mindfulness meditation? To overcome the suffering, dukkha, to attain the Nibbana. So that's the Buddhist aim of the practice. Goal, supreme goal. We have a supreme goal to overcome the suffering. So that is what we call the religious practice. For many people, that people would say that's the Buddhist mindfulness practice. When I started my secular mindfulness training with University of Bangor in North Wales, I was the only Buddhist monk there. I just went like this with my robes. And the first time when they interviewed me, the director of the mindfulness center, and was very careful about the questions. And also she wanted to know whether I have everything like my certificate. Then I went through that. Then they asked me, do you have you done the 8-week course, MBSR, Mindfulness-Based Stress Reduction? I said, no, but I have my personal practice. I think this is the first time they allow someone to do the MSc course without doing the 8-week course, but I had to do it part of their foundation course because that's the secular mindfulness. So they don't have any kind of religious background to that. No pansil, no itipisoso akata supatipanna, no offerings, just an educational program. So that's why even meditation, the word is religious. If you take the dictionary, the meaning, so meditation itself has been used as a religious word. Meditating on maybe God or supernatural being, the qualities of a God, something like that. That's why in the West, people see the more health professionals or educators, mindfulness practitioners, secular mindfulness practitioners, say it's a mindfulness practice. More people don't say as mindfulness meditation. When you say mindfulness meditation, naturally it becomes a kind of religious practice. So as Sri Lankans, we don't have any issues with that because mindfulness is mindfulness for us. Doesn't matter like you observe 5 precepts or pay homage to Buddha or not, doesn't matter. If you are aware of your thoughts, feelings, emotions, and if you live in the present moment, being aware of your thoughts, feelings, emotions, whatever, just being here and now is practicing mindfulness. So secular mindfulness was introduced to the mainstream of the medicine in 1970s by John Kabat-Zinn from the University of Massachusetts. Being a doctor, was running a stress reduction clinic and also having some Zen Buddhist practice by himself. So he used these mindfulness meditation techniques at his stress reduction clinic. So then he found amazing result from his patients who were able to reduce their stress, anxiety, panic attacks, and symptoms of depression. Then he wanted to continue this more. So at the end of the research, and he published a book called The Full Catastrophe Living. So this book made a huge impact on practicing mindfulness in the West, especially mindfulness in medicine. Many years ago, I saw an advert saying mindfulness in medicine, a one-day workshop for health professionals conducted by the University of Glasgow. So I was surprised to hear, because I was practicing the Buddhist mindfulness, when I heard mindfulness in medicine. That was quite amazing experience and curiosity. What is this? How they use mindfulness in medicine. So I rang the university and asked, I would like to do this course. I would like to attend this workshop. Then the lady who answered the phone asked me, are you a GP? GP means the general practitioner in this country. You're just your family doctor, in other words. So I said, no, I'm not a GP. Then she asked me, are you a health professional? I said, no, I'm not a health professional. Do you work for NHS? That means the National Health Service of this country? I said, no. Then she said, no, I'm sorry, this workshop is not for you. I said, well, you have advertised it as mindfulness in medicine, mindfulness is my personal practice as a Theravada Buddhist monk. And I don't know from what grounds that you are saying mindfulness is not for me. That's something I started at the age of 10. Even before that, with my grandmother. And then I think she got my message, said, I'm really sorry, I didn't mean that. This was funded by the National Health Service as a CPD course, Continual Professional Development course for GPs, because we have a huge interest learning in mindfulness. So very special guest speaker is coming from University of Massachusetts, John Kabat-Zinn, and also some staff members from the Mindfulness Training Center, the University of Bangor. Then she said, yes, if we have places left, I will let you know, but you have to pay. I said, no problem, that I will accept that. So then finally I was able to experience this wonderful workshop. That is the first time I experienced and came to know about the secular mindfulness in medicine. Also, they were talking about mindfulness in healthcare and also education and other social settings. Now, the latest thing is the mindfulness in professional life. So then they developed it. 2002, University of Bangor, 3 professors, including Professor Mark William Siegel and his colleagues, and who were coming from the CBT background, cognitive behavioral therapy. That was another therapy for depression in this country. So they developed John Kabat-Zinn's MBSR, Mindfulness-Based Stress Reduction, 8-week course, and using CBT scales, they developed something called Mindfulness-Based Cognitive Therapy, which is an Mbct. So in the secular mindfulness practice, the modern days, we have 2 main courses. Both courses are 8-week courses. Mindfulness-based stress reduction, 8-week course is the first one, developed by John Kabat-Zinn. Then it's an 8-week course, 2 hours and half an hour per week, and including 6 hours silence retreat after week 6. So that's a kind of the first one. Then the second one is developed by them, Professor Mark William and his colleagues, called MBCT, Mindfulness-Based Cognitive Therapy for Depression. So I have some books. So kind of, if you have time, if you can find this book, and it's a Mindfulness-Based Cognitive Therapy by Rebecca Crane, and one of my lay teachers from the University of Bangor. And also, another latest one is Mindfulness-Based Cognitive Therapy for Anxious Children. I think Sri Lanka needs this more now because of this, the pandemic time, and school children were not having schools, and they were just online most of the time. So I think our children also they need more this kind of therapy, mindfulness-based cognitive therapy, especially for anxious children. Also, when you do this course, MBCT or MBSR, whatever, so that's another secular one I want to let you know. Because when you go to a temple, you just practice, that's it. But for all these courses, as they are academic courses, this is another one, Mindful Way Workbook, an 8-week program to free yourself from depression and emotional distress. Again, John Teasdale, Mark William, Sindel Siegel, these 3 people are the who has done this work, more work into MBCT. Therefore, if you can see, this is a kind of workbook, and also it's come with a practice CD. Okay, so when you have this CD, and there are like for each week, we have to do some practice, formal practice and informal practice. Formal practice is like body scan. You lying on your back and you practice 30 minutes scanning your whole body. That is also formal practice. Then 10 minutes sitting meditation, mindfulness of breathing. And also we have mindful movement practice, that kind of yoga practice. That is also formal. And also there are some informal practices like brushing your teeth and hoovering or cleaning, and maybe eating one meal mindfully, like using mindfulness in your everyday life. So that is also kind of mindfulness practice. We call it informal practice. So practicing with your teacher in the group is quite a lot thing. Every week we introduce formal practice, and also like you do in the guided meditation with the monk or teacher as a formal, someone is guiding through to do that practice. And in here you have the voice of your teacher. Okay, then that's a formal practice. Informal practice is just bringing in mindful skills to everyday life. So this is for the workbook for the MBSR, Mindfulness-Based Stress Reduction. So this book was produced by ourselves for our own students. So if you are doing the 8-week course with us, we will give you this book, and also you can see the things that you have to do here, like home practice diary. So then what was your practice and what did you notice during that practice? And, just sharing your experience. Then in the part of the group, we discuss your experience in a non-judgmental way. Sometimes when you're experiencing, you may cry, but there's no one to judge you, and don't cry, something like that. Why you are crying, you are so weak, and something. Nobody is making any judgment towards you. You just let go of your emotions. So that's the one thing within that group. Confidentiality is there, and nobody's going to share that information. We say whatever you are going to share here, it stays in this room. So as my counseling students, you know that the confidentiality is the one of the most important part of your practice as a counselor. Therefore, there are quite a lot randomized control trials done in the research field using these courses. I would like to share some of them, especially because my area is MBSR, but today I will be focusing more on Mbct, because as counseling students who are coming from the behavioral therapy background, if you want to integrate mindfulness into your counseling, as counselors, if we are going to become a therapist or counselor, then how we are going to integrate mindfulness into your daily life as a person, and also how you are going to integrate mindfulness at work when you are working with a client. That is the last thing I'm going to cover. Therefore, this background is really important for you to know. I got this information from the University of Bangor website. Therefore, the first one is which I covered about Mbct. Have you heard about these two words, relapse and recurrence? So these two words are quite important when you are reading research papers, because the depression, the nature of depression is occurring it again and again. Maybe during this time, during the winter, quite a lot of people experience the depression. Then you get the treatment for that. Again, after maybe a couple of months, maybe when you have challenging situation in your life, maybe someone died, or maybe you lose your job, then the depression may come up again. And also again during the winter time. So we call it just experiencing it again and again. So Mbct course done with the And like there are 9 main RCTs. RCT means randomized controlled trials, and using many countries. So they found quite amazing result, reducing the relapse and recurrence of the depression, like those who had more than 3 episodes of their life. So that's why it is quite important. The NICE guidelines, the National Institute for Healthcare and Excellence, that's the UK body, they have recognized Mbct as a therapy for depression in, I think, 2004. Therefore, that recognition was really important. Now, those who are experiencing the depression, they can practice, they can get a therapist from the National Health Service in the UK. If you can get mindfulness teacher from National Health Service, it is no longer just a Buddhist practice being used by everyone. So some of the research findings says affect 20% of population of some point in their life. So that's why depression is really important thing here, like when you talk about the health. Also, more than 50% of those who do recover will have at least one further episode. Those with the history of 2 or more episodes have 70 to 80 chance of recurrence. People with early onset depression and who experience depression in old age have a heightened risk at replace. So in 1990s, it was the 4th most common cause of loss of disability adjusted life years. This is the really important fact. 1990s. In 2020, it was the second major health issue. So now, in high-income countries, it is predicted to become the number of 1 cause of disease burden by 2030. That will be the most challenging. That's why more mindfulness practitioners need. That's why more Mbct practitioners needing this world. That's why more mindfulness-based counselors needing. So that's the one important thing I want. There are quite a lot of information, but I would like to just share this with you, because you may think, why I have to learn? You already have that answer. So stress, anxiety, panic attacks, or depression, those are the main health issues in the world right now, apart from this corona thing. Because of corona and the lockdowns, those diseases are increasing, the mental health problems and the mental health issues are there. Therefore, first you need mindfulness practice for yourself to protect yourself. As I mentioned you about as a self-help, self-care, your own mental and physical well-being. That is another important thing. You are practicing mindfulness. You are integrating mindfulness skills into your daily life, because more than ever, you need it. We all need it. As monks, as therapists, as lecturers or professors, we all have a very stressful life. Therefore, we all need to learn mindful skills. It doesn't matter secular mindfulness or the traditional Buddhist practice, because all these secular practices are rooted from the teachings of Buddha, the great Satipatthana Sutta. So that's the foundation, that's the base. So people can say, I developed this, we developed that, but everything, when you research those techniques, everything is from the Satipatthana Sutta. They have done so many research, like 9 randomized control trials in Canada, Australia, Finland, Switzerland, UK, and quite a lot of countries. They did this research together. That's how the Mbct work was introduced to the modern world. There are quite a lot research papers that you should try when you have time. There was a really interesting one by John Chambers and Judy Maris. This was published in 2010. I accidentally found this one, but I really like their findings. They have done quite a lot of research with counseling students. That's why it is important for you how to use it in the practice, like how it works in the West, and also how mindfulness can be used in your everyday life as well as your professional life. So in your professional life, what they have done, having counselors, especially the counseling students, those who are studying counseling, like most of you, and they introduced mindfulness. And also there are 2 groups. One group was both group were studying the counseling as the students, and also there were some group who are practicing already as counselors. And then there was some other group, they are counseling students, but they were not receiving the mindfulness practice. So from the groups who were practicing mindfulness, they have found this information. The students reported life changes related to the class in the following areas: physical changes, emotional changes, mental, attitudinal, thought changes, spiritual awareness, interpersonal changes. This is really important one, the interpersonal changes. When you practice mindfulness, and now quite a lot of students who practice here, the one thing they say, okay, we came here just to experience mindfulness as a secular. I had several health professionals who came from a mental health charity. They are clinical psychologists. The first time we asked why you are here today, then more people would say, I am here for my professional training. Some people who are very honest say, I'm stressed. No, I just had a problem and I lost my job. So I'm stressed. I'm here just getting some kind of, how to manage it, to learn something, new techniques. Some people say, oh, I am here just my professional training, my CPD. Okay. But when they come to week 4, they say, okay, now I think I am here just for myself. I was able to manage my emotions. And, they understand. They, like, I may ask, why you are doing counseling? Then your answer is, yeah, I would like to become a counselor. Why you want to become a counselor? Yeah, there are quite a lot of people and, who need counseling, who need our support. Then many students would say, I'm doing this for others. I would like to work as a counselor, then I can help many people. So why not you? The first thing, even though when you are a counselor, when you are studying counseling, the first thing is the skills that you are learning and practicing. It's for yourself. You need to have it within. You have to develop all these things first yourself. One thing would be, when you are I am going to talk about this, the way how we are going to integrate mindfulness into daily life. So most important thing, just practicing and developing it for yourself, for your own mental and physical well-being. Then you can share it with others. Okay. Reported impacts from the various mindfulness practices. And part of this, we have yoga. When they're practicing yoga, increased awareness of body, increased flexibility and energy, increased mental clarity and concentration. And meditation section, increased awareness and acceptance of emotions and personal issues. This is really important, another part of it. Like, we are not happy to accept things. Can you remember when I started my talk, I said, okay, accepting, allowing, letting go. So, like, you were paying attention to the sounds. What you did? You're allowing sounds to come. You didn't judge. You didn't want to just go away, go away. But when you are studying, your little brother maybe just making some noises, your mom will be cooking, and there's a television, a teledrama. Okay, the Nadagamkaro is behind you. Okay, so then you say, no, just put the volume down, I want to study. So what you do, so sometimes you would like to watch the teledrama, but you say, no, I have to do this assignment. So you just try to push them away, go away, go away. But then more you get your irritation thoughts, your upset, anger, everything is there. Why? You are not happy to accept them, allow them. It is same with any relationship. Sometimes we don't listen to other person. So when you go and when you are married, when you meet your Nandamma Leli, okay, so then your mother-in-law maybe is shouting all the time, but you are not ready to accept it. That is the nature of my husband, mom. That's okay. But we are not ready to say that. Then why she's doing this? Why she's behaving like? Why she's not welcoming me? I think she hates me. That's how you think. But you are not ready. No, that's okay. That's how she is. When you try to learn to accept things, since then, you are developing your own inner peace. It is same when others are shouting or screaming and whatever they are doing. If you try to accept it, it is okay. So part of this mindfulness practice, those students, they have reported. So increased mental clarity and concentration, and also increased awareness and acceptance of emotions and personal issues. This is one point. There are quite a lot, but I just want to share with this. Increased tolerance of physical and emotional pain. So Vedana in Pali, when you practice mindfulness, we do the Vedana, being aware of the pain. In the West now, they have developed something called mindfulness-based chronic pain management. Some people, they have to live with those chronic pains. Then how we are going to manage that pain and discomfort without having another mental health issue. Because as you say, there are two arrows. One is your natural pain coming from that difficult leg or arm or whatever. That's the nature of that illness. Then on top of that, you have the mental pain. So physical pain and the mental pain. It's just like you were hit by two arrows. So you can bear the physical pain if you can manage your mental pain. So being aware of the pain, noticing when the pain is arising, paying attention to that. Now it's already 1 hour. Maybe this is time to practice, about something about your pain, the discomfort. Okay. So let's do another short practice to understand this properly. Try not to change your posture. Just be there as you are, paying attention to your whole body. How about my body right now? Is there any pain or discomfort? Are you relaxed there? If you scan your body from head to toes, you will find pain or discomfort somewhere in your body. How about your feet? Is it cold or warm? Maybe your thighs, and paying attention to your buttock, feeling the pressure and the connection there. If you're experiencing any pain or discomfort, any part of your body, just noticing it first, then I would like to invite you to pay attention to that particular part of your body. How about my pain right now? Okay. Pain is there. Maybe some people who are not experiencing any pain, they can just pay attention to your back and the lower back and keep your back straight and try not to move it. Then in 5 minutes, you feel kind of discomfort there. Noticing that pain or discomfort arising, continuing, and developing, then passing away. It won't be there permanently. Changing. Everything is changing. Even your pain also changing. It is not a permanent pain. Arising, continuing, passing away. 3 stages of any pain. Then you will experience the pain from somewhere else. Okay, if you have severe pain, paying attention to that pain and also breathing into that place, breathing out, letting it go. Breathing into that muscle or any part of your body where you experience the pain, then noticing it. When you breathe out, let it go. Breathing in, noticing that pain, breathing out, letting it go. Okay, so please open your eyes now. This is really important practice. Like when you are, I mentioned you like at the end of the talk, I'm going to share some of our experience, how you are going to integrate mindfulness into your daily life, also professional life. Because this is I was going through this research paper, what the students have found. So you can implement, you can experience, you can implement mindfulness into your life, and also you can use it for everyday life, as well as when you are at work. So we have something called, and it says, increased sense of relaxation. So now you feel relaxed. You're increasing it. Why? For more than 1 hour, you're paying attention. You're paying attention. You're trying to listen to me. You are mindfully listening to me. And you are hearing. You are gathering this information. So then you are still being mindful. And we were having specific mindfulness, just paying attention to your body and also any pain or discomfort. So now part of that, as a byproduct of living in the present moment, here and now, you experience increased sense of relaxation. So Qigong, that I'm not going to talk about Qigong part because you haven't practiced Qigong, and also reported influences on work with clients. That is the important one. Okay. Increased comfort with silence. I think now you understand what that means. Maybe you're already practicing mindfulness, and also maybe you're already practicing your counseling skills with your clients. Maybe you have experienced counselors here, then they know what I'm talking about. Increased comfort with silence. When your client is not talking, then sometimes we need to have some kind of silence time. For some people, that is very challenging, difficult. When other person is not talking, when you don't have to say anything, you may say many things which will disturb your client. So it is okay to have silence time. You don't say anything, your client wouldn't say anything. So what you are going to do that time? When you integrate mindfulness into your counseling, you can say, okay, maybe you have too much going on. You are here to share some of those experience. Maybe you want to offload things here, but it is okay sometimes. If you're trying to find the right word for that, please take your time. While you're doing it, you can pay your whole attention to the body. You're being aware of your thoughts. So you can give some instructions, but we are not giving any advice to your client. Part of the counseling, we don't give advice to clients. But in Sinhala language, counsel is upadesane. So people think, okay, I'm going to meet a counselor, and upadesakaya. Upadesaka, the word itself is giving advice. I don't know the CBAS, the policies about, the word counseling and the upadesana, how you are going to do the upadesana. We will talk about this, during the discussion time. And upadesana is the right word for counseling. Okay. But in certain ways, counselor can show the different path and guidance, but we are not supposed to give that guidance, so advice, but we can show them different paths. So that's how Mbct is important for you as counselors, because cognitive behavioral therapy is a very specifically developed to ask questions. Okay, for an example, now you this Vedana, paying attention to your Vedana or the unpleasant feelings or pain. At the end of the practice, I can ask you, how was it? Then you would say, oh, that was great. Thank you. So that's the normal questioning. How was it? Then the client automatically would say, that was great. Thank you. Then if you ask, okay, we are coming to the end of the practice. What was the experience? What did you notice during that short practice? That's the CBT questioning. Rather asking how was it, then the patient or the client would say one word or two words. But if you ask what was your experience, what did you notice during that time? We allow person to share the full experience, letting him or her to talk more, to let go. Those are the some that I gave you just one example how to use that technique. Also, more attentive to therapy process. So sometimes when you have 40 minutes counseling session, you lose your awareness. You experience the wandering mind. You may experience the spacing out. The person is talking. You're thinking something happened in the morning. Maybe you're thinking, okay, what should I take my home? I don't know whether my wife will cook or do I have to take some koturoti for them? So you are listening to the person, the client is in front of you, but you are thinking your shopping list, you're thinking what you are going to cook for dinner. So sometimes your mind is just spacing out, blank, nothing. And you don't know where was your mind. But if you are really being mindful during that time, you won't experience it. Like you may experience definitely when you start your life as a counselor. Sometimes people just talking, and it's boring. And but you think, oh, I have to listen to this guy because he or she has paid, or I have to be with the person. But remember, when you are not listening attentively, when you are not paying attention to your patient or the client, whoever in front of you, and will realize it. Okay, even though if you just look at the clock, then person know, okay, no. He is not interested. I'm not coming here again. The person is making judgment by himself or herself. Therefore, more attentive to therapy process is really important. Like when you have session, you divide. Okay, first I'm going to ask this person, how are you, and how was the day, how was the weekend? Just to be familiar with the person. Some very informal questions. And maybe did you have something to eat before you come here? Would you like to have some water? Are you comfortable here? Some kind of confidentiality thing, and also just informal discussion. And then, okay, now last week we discussed this. Okay, what was the experience during the last week with your wife? And so then the person, forget about her. Okay, then what happened? It's the same thing again. Then the person knows, oh, and he's interested to know more about my wife and the problems that I am having with her. Okay. It is quite important. So when you practice mindfulness, when you are really aware of your own words, your own physical body language, and also when you're paying attention to the person in front of you, okay, so it is really important that. So those students, the counseling students, after completing the 8-week course, they have reported more attentive to therapy process, change in how therapy is viewed. So sometimes you go through the books, you understand the theory. Sometimes you say, no, this is not working for me. I have to try differently. Because when I ask the question this way, I know the person is really interesting. I can see his eyes, So eyes is open and like I can see the sharpness and also willingness to share something with me. And sometimes when you ask, okay, oh, what happened? Yes, so the person will just change the seat, and okay, then you notice the person's body language. Then you are more into that. At the same time, you are aware of your own body, you are aware of your thoughts, you are aware of your feelings, and also you are aware of the body language of other person. That will make, and also you develop compassion and kindness to other person. That is another thing I would like to bring to your attention. You are a counselor. If you are a counselor, you are not just a listener. Remember that. In the Western psychology always say, okay, you are a good listener. You have to develop the listening skills, not only listening skills. You need to develop more mindful communication skills. I think, Professor Chandrasekhar, that will be another topic for us to talk about, like how we are going to develop mindful communication skills. That is another different subject, mindful communication skills. So we have nice, one I would like to share, because we have another 15 minutes, and this is the last one I want to share. Mindful communication skills. When you are using mindfulness into your counseling, one of the main things you need to develop. It would be nice if I would use this. It would be really nice if you can develop mindful communication practice. The one thing, you need to understand when the person is coming to you, his or her mind, the frame of mind, and also the behavior of the other person, and how the other person react to the another person's behavior. It affects the person's frame of mind. This is a kind of theory. For an example, someone would say, something really negative, angry. Then you know that person's frame of mind is negative. When that person's frame of mind is negative, even though when you look at the clock, that person judge you negatively. He is not interested in listening to me. Why? Because that person came into your room having kind of challenging situation. Therefore, that person's frame of mind is not positive. It with some negative emotions. So your reaction, maybe you have another colleague, then someone is just, looking at something behind that person, then the person sees someone is watching me. Why she's watching me? I'm talking to my counselor, or someone else, but actually that person is not watching your client. He or she is watching something else. Because of his negative frame of mind, that person makes judgments. It is not a positive one, it's negative, judging negatively. So it is same like at work, like when you come to college, someone is upset and behaving inappropriately, maybe anger, aversion, maybe like you say to someone, good morning, hello, good morning. Then the other person is not greeting you. Then you make judgment. Why she didn't say good morning? Any particular reason? No, I didn't say anything bad about her, but she didn't reply me. She didn't greet me. Then your ruminating mind, you are thinking about her. If you had your frame of mind was negative, you are judging so harshly the other person. Maybe your friend didn't hear you. But when you go to your seat and still you're thinking, why she didn't greet me? When I was so nice to her, but we don't know why. Maybe she didn't hear you. Maybe she was thinking something else, and therefore she even didn't see you. So especially when you are working with your clients, you have to understand the person's frame of mind. So how you are going to find it? Because you are not having this, supernormal vision, or dibba chakku or something to see, or even like, to know the other person, parachitta vijanana, jnana, or whatever, super psychic powers to understand the other person's mind. But just watching that person's body language as a professional counselor, you can understand. And asking several questions in a very friendly way, you can understand it more. Therefore, listening and talking to other person is the mindful communication. It is really important. Even like when you are listening to your wife, when you are listening to your husband, when you are listening to your children, when you are listening to your colleagues, when you are listening to your teacher, when you are discussing each other, then we need to have this mindful communication. So I'm coming to the end of my talk and just covering the last part, like integrating mindfulness and self-care into counseling and psychotherapy training. So that the last one I wanted to cover. So I gave you several examples. Like even when you are sitting, if I'm going to summarize it, first, when you are meeting someone, you greet the person. You greet the person with kindness and love and compassion, with gratitude. Hello, good morning, how are you? And if you shake hands, nowadays new, okay, and then you just welcome the person. Like as soon as you see the person, just having the eye contact together. But remember, not more than 10 seconds, okay? And then having that eye contact, greeting the person, and having a nice smile in your face, and welcoming person, and really being mindful that moment. And inviting to your room and just giving a chair. And if the chair is just covered, then you can just, take it to the back by yourself and offering that seat with kindness and just please sit down, and then offering glass of water or whatever, and everything. You are not acting. Okay? You are just showing your empathy, kindness, and also we call it practicing advanced empathy. Is something else. Practicing advanced empathy. You think, okay, I know how you are feeling. That is also another thing you need to be very careful. So sometimes, for an example, think, okay, you are a newly married wife and a counselor. You have 60 years old mother, housewife, who lost her husband recently, who were together maybe just for 40 years. Okay, you are just married. And then the person is saying, I'm really upset. And, my husband, we were together for 40 years and he died. And it is really difficult for me. And, it's really challenging time. And if you say, yes, ma'am, I know how you feel. Okay. Are you telling the truth? You're practicing advanced empathy. The other woman can say, no, lady, you don't know because you are just got married and you didn't lose your husband. He's luckily there. But I lost my husband. You don't know how I'm feeling right now. So we have to be very careful when you practice advanced empathy. You don't know how she feels. She lost her husband who had maybe 5 children, for maybe during that 40 years time. Then when you say, yes, I know how you feel, doesn't make sense. Okay, there are quite a lot to share with you. When you bring some kind of language into your professional life. Anyway, so self-care is the most important thing. As I mentioned you very beginning, you are learning mindfulness. You are practicing mindfulness. You are learning counseling skills. Okay, you are completing your diploma in counseling. Not only just to help for others, for yourself, for your family. You are going to apply all the theories and the practices you have been learning and practicing throughout your course, first nurturing it to your mind, to your whole life, practicing it and using it for your self-care. And also, you are becoming a sponge. When you are listening to other people, you are getting their challenges, their anger, their aversion, their negative emotions. Everything comes to you because you are listening, you are watching, you are attentive to listening. So then how you are going to cover yourself? How we are going to make a shield for yourself? Have you ever thought about it? Because if you don't protect yourself, you become a sponge. You get absorbed everything for yourself. So what you're going to do when you go home with those upsetting thoughts, because you are a human being. You are a human being. When another person is crying in front of you, maybe a woman, if you are a women counselor, when you are listening to another, the women's, the suffering, that will be really difficult. That is really difficult, challenging. Another person says about something, her child is not well or something. Then if you are a mother, if you are a father, you have the same age children, you have children. Then maybe you have go through that situation. Then you get the emotions here. You experience a similar kind of karuna, paradukhe kampatiti karuna. Having seen someone else suffering, if you are experiencing anything here, kind of positive emotion, it is called karuna, compassion. We need to have the compassion in action. At the same time, if it is too much, overwhelming, then you need to learn how to manage it. Positive emotions and the negative emotions. Quite important. So taking care of yourself or self-care, it is really important in any profession. We call it burnout. Have you heard this word, burnout? So it's a quite used word, especially the teachers, and now when they go to, like, if you have any teachers here, when you go to schools now, then you know how challenging those children, your pupils, students. And if you are a mother of 2 or 3 or father of 2 or 3, then you know how challenging they are nowadays. They don't go to school, and they, like, more than 18 months, they were at home and they are bored, and and they didn't have enough engagement with others, didn't go to play with others, and always the television or the mobile and the games, then they get more hormones like dopamine. When they have too much dopamine, they need more and more, then they get mobile addictions, and sometimes they are not listening to you, then you experience aversion and anger. It is not easy. It is not easy nowadays, the children. So then how you are going to manage? So when you are doing the child counseling, like here, this book about the anxious children, it's really challenging. So when you are working in this mental health sector, you will be working with people who get anxiety, stress, panic attacks, depression. We need to be very careful when you're working with them, especially, they're like mild depression, it's okay, but clinically depressed people, then if you are doing your counseling, you have to look after yourself. You need to have, the quite a lot protection for yourself. We are not discriminating anyone, but you need to be very professional. Otherwise, we will be going through difficult, challenging situations. We want to help people, but they are mentally not accepting something from you, and then that can be twisted easily. So we have to be careful. There are quite a lot. I think part of your course, you will be taught about those, the ethics and how to protect yourself as a professional. But I'm talking here how to protect yourself from your own emotions due to your clients or family members, your friends, doesn't matter whoever. It's ordinary people, always we are having challenging times. Okay. Therefore, those are some of the things I would like to share. As too much information is no good for you whole day, like the last half an hour. And I was thinking to share with you about the last 30 minutes, your question and answer time. So that will expand our wisdom more, and we will be able to share more. Okay. So thank you very much for having me here today. And also I'm really grateful to Professor Sarat Chandrasekhar and his colleagues and all the students who are here today. And thank you very much for listening to me. And the next 30 minutes or more than that, I am okay. And if you have any questions related to my talk about the 4 sections of this talk or any other practices, if you want to know more about the training, I'm very happy to share about, like, okay, you think, I would like to become a BSR teacher. I would like to become MBCT teacher. Yes, of course, you are very welcome. And I told you, like in 2030, the depression would be the most challenging disease in this world. So we have to prepare ourselves. So if you are doing counseling, then learn more mindful skills, integrate mindfulness into counseling. What it doesn't matter you are doing the humanistic counseling or any other counseling thing like person-centered or group therapy, whatever. And if you integrate mindfulness into that, and you will be a great human being, you will be a great counselor and great person, whoever, whatever you are, teacher or a counselor or mother or father or brother or sister or a student or teacher, whoever, you will be with more good qualities and great qualities. And so in the West, there is a huge demand. If I can't see the whole places here, but if there are any young monks, I would be very happy to help them and support them. Just learn properly and practice it. And this whole world is open for you. And I'm trying to find out some young monks here, but it is very hard, especially the monk with IELTS 5.5. Okay, that is the challenge. And because you all, this is the one thing I'm really grateful to SIBA, because your medium is English. Okay, until I just do my advanced level, I didn't have much English knowledge. Okay, so Dr. Chandrasekhar and other colleagues who were seniors, and they encouraged me to do study in English medium. So I'm really grateful to you, and especially the young monks. You all have great opportunity to learn in English medium and also to learn this modern subjects with the Buddhist background. So we are not losing our roots. We are practicing the teachings of Buddha, and also we are learning deeply the Tripitaka, and also we are learning the Western theories and psychology and counselings. And then you can be a great monk or a nun and a layperson, upasaka, upasika, and you can do a great service to the world if you develop more and more with the Buddhist practice. Okay, so the world is open for you all, not only the monks and nuns, but also everyone. The Western world is asking professionals with kindness, compassion, and great training. So thank you very much.
Yes, thank you, Venerable Sir. So now it's time to ask the question and answers time. So we have with us, especially our department colleagues, respected Venerable Viharagala Panyaloka and also Ms. Subhashini, and I'm happy with them. And so now all other students, so now time is for you to get any clarifications, anything you really wanted to ask, then Venerable Sir is ready to give the answers with the discussion. So now it is your time.
I think all understood. සිංහලෙන් උනත් කමක් නෑ. සිංහලෙන් උනත් කමක් නෑ. අහන්න. Yeah.
Venerable Sir and our Sir. I was a bit late to join this program because there were 100 for 10-15 minutes, but I could join with YouTube live. Then, Reverend Sir, I have some questions to get some clarifications. First one is, Reverend sir, you said that some courses, 8-week courses, so can't we follow them here from here in Sri Lanka? And the other one is, you mentioned some books regarding mindfulness-based cognitive therapy, and another one you told that the Mindful Way workbook. If we need those books, how can we get those books?
Okay, thank you very much for your question. One thing I would say, yes, the MBSR, Mindfulness-Based Stress Reduction 8-week course, and we run courses from here. And I don't think in Sri Lanka, I know, as far as I know, there are 2 people, those who have completed the MSc course with University of Bangor. And I don't know they are running any courses. I will check and let you know. But like in here, like whenever we are doing the courses, like I will be running some several courses, MBSR and Mbct from Germany next year, and we are going to have a Zoom session, like one course just for the teaching MBSR, Mbct using the Zoom link. Okay, so then you will be able to practice and learn it. And also, yeah, that's another way. And we have another good way of, if your university can organize the 8-week course, okay, part of your syllabus, and introducing MBSR course. I think for you, the much better doing the MBSR or MBCT, both are okay, but MBCT, I would say, the one of the most important thing, if you are going to be a counselor, you will be learning quite a lot CBT skills from MBCT course. Therefore, if your department can organize MBCT course for yourself, the students, and we are very happy to facilitate. The workbooks, yes, and this workbook you can order it from online, but you need to have a teacher, you need to have a practitioner, someone going through, like here is the yoga, and then you need to practice it with your teacher the week by week. Every week we have something to do. So this is our book. That's something I prepared for my students. Okay, and it is basically from University of Bangor information. So each week, and we have a session. We have home practice. So therefore, you need a teacher, and while you are doing your 8-week course, then only this book is useful. If you are going to do MBSR or MBCT with us, we will give you the relevant workbook for you. And also, if you are going to do course with someone else, and they will give you the workbook. Okay.
Okay, thank you very much, Reverend sir. Actually, it was a great program because we are waiting till something comes from Western countries. But today we got to know that when we talk about the relaxations and other things, they are from here. I mean, from Buddhism, and it was great, Reverend sir. Thank you very much.
Thank you very much for your feedback. Really appreciate it. විවෘත සංවාදයක් නිසා සිංහලෙන් කැමතියි සිංහලෙන් අහන්න කමක් නැහැ.
Yes. අනිත් අයට ප්‍රශ්න අහන්න අවස්ථාවක් තියෙනවා. අපේ දරුවන්ට පුළුවන් අපි දැන් ඉගෙන ගන්නකොට Buddhist counseling, psychology, treatment planning and Buddhist counseling. So all you can ask the questions whenever sir is ready to give the answers, or at the same time you can give the feedback also while same time, and don't waste the time. So you can use for the time for the both purpose to give the feedback at the same time and get any clarifications.
Good evening, Reverend sir. All the people who have disorders in their mind doesn't like to meet the counselors. At that time, how we apply this mindfulness activity? Please explain this.
Okay, thank you. I think it's a really good question, because sometimes, there may be their doctor or family is forcing them, okay, you need to go to a counselor. So then sometimes they are not willing to come because they don't understand why they have to go. And part of our culture, some people don't like to be open. They don't like to share their personal things with someone else.
Yeah.
And that's the one reason. Maybe they think, okay, maybe if a young girl is coming with her mom, then you go to your counseling room and start counseling, and then you can see the girl's eye contact is not having with you. Maybe she's just looking at like this. Maybe she thinks her mom is listening to her.
Of
Okay,
course.
you can understand just observing her body language. Okay, and also maybe if she's just checking the phone most of the time. Okay, maybe something else. Most important thing is understanding the body language, and will give you quite a lot answers about that challenging situation. And also the first session, the contacting session, the first one, and it would be really nice if you can make a kind of good relationship, especially your confidentiality, how you are going to work with this person, and you are not going to give any advice or anything, but you are here to just to support her. Okay, you can share anything with me, but everything only in between you and myself. Okay, but sometimes, although we say that, if sometimes there's something you have to share with the parents. Okay, and then is it okay if I share with your mom or dad? Maybe there are some issues related to legal issues. Then sometimes you have to share with these things with the police. Okay, having said, okay, I'm not going to tell anyone, to protect that person, sometimes you have to take some actions. Okay, but like your question was in how I'm going to listening to this person, and how I'm going to encourage that person to talk more and to be with me during that time. I think it's the whole thing would be first showing your, and just the not showing, actually the word is, you have to behave the way how your client can understand your motivation.
Yeah.
Okay, your compassion, your kindness, and your willingness to help that person. And I think that is the most important thing. Those are the qualities that you have to develop. You can't learn it from the book. Okay, and this is the one reason you need to first have more counseling hours with your friends, or that people that and maybe we call the peer counseling. If you are in, maybe if you have 10 students in your counseling group, then you can have maybe just 5 groups, and always they meet together like a close friend. Then during that time, being a close friend, you learn, you share things, you listening to other person. You both are going to develop really good friendship, as well as counselor client relationship. One week you become the client, the next week you become the counselor. Okay, by doing it, that's another technique we use in the West when you are doing the counseling course, like peer review, we call it. Like, you act as a counselor one week, and your friend act as a uh, client, or the patient, or the person. So then you change the role. By doing it, you practice all the theories that you are learning, and you understand, and then there is that person is not going to judge you, and you openly share your experience, what was your strength. Okay, and your skillfulness, and the questioning, and areas for further development. You can say, when you ask that question, I was so angry. Okay, then that person know how she is going to ask the same question without making anger the other person. I think those are the skills that you have to develop.
Okay, understood. Thank you so much,
Okay,
sir.
thank you.
Any other questions? Yes. So, Venerable Sir, like, how is how they practice, and what is the, like, whenever we say about the Western people, how they interest about the Buddhism or the mindfulness-based cognitive therapy and mindfulness-based stress reduction,
I
and at
think
the same time for the Buddhist meditation, or what is their, like, perspective?
yeah, I'm very happy to share one of my experiences, because very beginning when I started the center 2002, we advertised the Buddhist meditation. We had only 2 people. Okay, so then the next week we changed it, like Buddhist meditation and relaxation. Okay, then there were 4 people. Okay, and so then after doing this course, and we say, when you advertise it, okay, mindfulness for stress reduction, something like that. And when quite a lot of people, when you have proper center and a website, all the information, scientific, the information, then actually we were really busy. I started by myself, and we were really busy. Like 5 days I had, because in this room we have only 10 people or 8 to 10 people. It was really busy. Then I was invited to University of Glasgow. This is another good point for you. Like in Glasgow, we have psychological and counseling department, psychological and counseling services. And they all, when the students are going through challenging time, they come to the department and they seek support, the counseling. Okay, but then they wanted to introduce mindfulness-based stress reduction, especially during the exam time. That the students are going through exam anxiety. So I was given 15 students. Like, then that means the department can save the money, because then you have to give 15 students to 15 counselors. Now just one person is the covering 15 people. And then it became very popular, because it was not just listening, and we have yoga and practicing, and it's a group theory, group practice, everyone together, young, the student and staff. So it became very popular. I think I wrote somewhere in even UK, more than 8 million people have mentioned, that they have practiced mindfulness. So I read somewhere recently, more than 8 million people have mentioned that, they have practiced mindfulness. It is becoming very, very popular. I think there are 227 schools in England, and they introduce mindfulness as a curriculum. They have mindfulness syllabus there, and we have .B, post B courses. We train teachers, to teach mindfulness in the classroom. So there are quite a lot that teachers, and they are paid by the education authority to do we had so many teachers here. They came to learn mindfulness with the intention of integrating mindfulness in their classrooms. So after completing the 8-week course, they have to practice 6 months, and then they can do this post B or .B. These courses, like 8 weeks and 6 weeks, 7-week courses with the PowerPoint presentation and practice. Especially we teach mindfulness, like for an example, for children, like we say, okay, keeping your hands on your belly and the other one on your chest, and being aware of it, noticing the rising or falling of your abdomen and any sensation of the chest area. So very basic techniques. And also we have finger breathing. Breathing in, breathing out. 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 Kids still love this exercise. We have another one called the petal practice. So paying at it, like, then we ask them, okay, this is just like a flower, lotus flower, and it's blooming. Breathing in, breathing out. Breathing in, breathing out. And these are some of the very basic practices for children. So in many schools, and they are adopting mindfulness into their classroom because of the difficult classroom management and behavior issues, and they are quite happy to teach mindfulness in the classroom. So, and like city councils and quite a lot, the private sector, and they have staff day out, and they come to mindfulness center and they practice mindfulness. Sometimes they invite us, and we go to the city council, and we go to those, the professional business places, and we do maybe 1 hour introduction to mindfulness, maybe mindfulness test session, and it's a very, very popular practice in the West. Some people, why I like to teach secular mindfulness, because of the religious conflict in these countries, then they think we are not religious. We are not belong to any kind of, the religion. In Sri Lanka, we have something called Niragamika, similar kind of that. But if you say, okay, I'm going to go to a Buddhist temple to practice Buddhist mindfulness, that may put off some people. But then it's a secular mindfulness, oh yes, we love it, because it has 30 years ongoing research evidence to say it helped to develop mental and physical well-being. That is the one reason. And also it's more scientific, and also it has set up, like in the West, people like 8-week course, 6-week course, the 2-hour session, something like that. It's a kind of fixed mind, the system. Okay, so they like it. So that's the one reason the mindfulness became more popular. People are really stressed. In Scotland, 1 in 10, they take antidepressant, like medication for depression, and maybe 1 in 5, they have stress, and it's a quite a big problem. And without taking any medication, which has side effects, especially when they have mild depression, GP can say, yes, you can practice alternative thing. You can practice yoga, or you can practice mindfulness. And if you would like to do Mbct course, I can give you referral to another mindfulness therapist. So then they like, because when you take the pills or the antidepressant, they think we have to take it whole, their life. They don't like it. Then they try those first 6 months, they try many things to let go of their depression or to manage it. This is the one reason mindfulness is becoming so popular in the West. Thank you.
Yes, thank you, Venbal sir. And what about the counseling perspective in this Western way? Because many of them are thinking after completing our graduation, many of the student, and not only the student, now every Sri Lankan is having idea to go to abroad because the country situation and all. So I just wanted what kind of opportunities do they have in your country and England and all other countries, what you have experienced?
One thing, Professor, what we have to do as part of SIBA, there is an organization called UK NARIC. Okay, so if you are registered with them, UK NARIC, okay, then you have to send your curriculum and everything for them. They would say your diploma in counseling certificate is equivalent to diploma in counseling in the United Kingdom. That is the first thing. Okay, so if you get that certificate from the UK NARIC, so you're a student, and when they come here, and they can apply for the jobs, okay, especially the NHS jobs, and they are looking for many counselors and health professionals. Okay, even like if you have developed counseling skills, the easier job you can find is the caregivers. Like in quite a lot, huge demand in this country for as the caregivers, and then you can start your life from there. Another thing, if you can get IELT is more than 7.5, there are quite a lot opportunities to get to do your postgraduate degrees, PhDs, and also straight away join into the National Health Service. Okay, and because you need to develop those qualifications, then the world is open for you. And especially the English language qualification is a must. Okay, where you can easily get the visa you need to have your professional qualification, which is the recommended by, and we have another organization called BACP. You can Google it. Like if you would like to become a counselor in this country, and then you need to get the registration from British Association of Counseling and Psychotherapy or something, BACP, accredited. Okay, then you can talk to them. You can send your syllabus things, and then you can become an accredited organization. Then for these students, their path is very clear. And Sri Lanka needs more than ever, but those who get this, the qualification, who can develop, when you have the aim, okay, then you will develop it. Therefore, National Health Service, and you can, and also there are quite a lot private organizations, and they also have quite a lot vacancies. And also you can come to here, like some universities, they give you 500,000 scholarship if you would like to do a full-time course. Some universities, and they give you, the scholarship like 5,000 pounds, and but it will cost maybe some more, like 10,000, 15,000 to get the full registration. If you don't have that much money, come to this country as undergraduate or postgraduate students, you can just develop your whole education with SIBA and get the accreditation from those UK recognized bodies. Then it's not only this country, anywhere in the world, you can do your service. And also, and you can help back to Sri Lanka. Not only just, that you are giving your service, but you all, you get your primary education and secondary education through our country. So it's your duty to give back something to your mother country. Remember that too.
Okay, thank you. Because I asked that question nowadays, all students are trying their best to searching about the post graduation and also the professions in different countries, and recently have the very big queue in passport office also. That's why, what kind of opportunities do we have in those countries? And especially, like, I also inform them, like counseling and psychology, they do have a very good opportunity while they have to get the more and more qualifications, not only the one, and even we have the diploma, high diplomas apart from the degree program. And also they can continue after that, even they can do the Peradeniya University postgraduate diploma in psychology and lead to the MPhil and PhD.
Yeah.
So that will also there, right? Any other questions or any comments?
I think that's another good quality of a teacher. Thank you.
I would like to get this opportunity. Excuse me, I would like to get this opportunity to show our gratitude. Behalf of our teachers who followed the school counseling diploma at SIBA, towards Professor Sarachandra giving me golden opportunity, spent with the Venerable Sir. Very useful time. Thank you so much.
Thank you very much for sharing your thoughts and honestly and your feedback. Thank you, Theran Sanne.
And Venerable Sir, like in from the Dinwara and Vattegama, so we have the Tamil Muslim and all like secular mindfulness. So we conduct in Tamil medium also.
Okay, yeah.
Yeah, we are conducting Tamil medium exams. Yesterday they all written in Tamil medium. So do we have all kind of religious people also, like Fariha and all these our Muslim friends also?
Can I ask a question?
Yes, please.
Yes. Yeah.
Sir, my question is how to manage our stress according to the teachings of Lord Buddha. I mean, we have to get the examples of Jataka stories. That is my question.
The line is not clear. Can you repeat the question again, please?
My question is how to manage our stress according to the teachings of Lord Buddha. that means we want to take the examples from the Jataka stories.
Okay. So actually, Jataka stories is a way of teaching us the morality, okay, sadachara or moral life, and especially mainly the karma. When you do good things, you will get the good result. When you do bad things, you get the bad result. Actually, the original teaching of Buddha is if you follow the Noble Eightfold Path, okay? If someone asks me, okay, what is the best practice, as a Buddhist, I would say, okay, and just follow the Noble Eightfold Path. That is the path of the like liberating ourselves from suffering. And also it develops your personal life and the professional life. So if you study more about the Noble Eightfold Path, part of that you develop loving kindness, compassion, everything. Important thing is like, the starting from the basic 5 precepts, okay, and then being good to yourself. I always say 5 precept is you are going to self, the caring person, you are going to take care of yourself. That's why you are observing 5 precepts, okay. So starting from the 5 precept, when you start 5 precept, the avoiding from this the sakusalas, like in a simple language, if you follow the Ari Atamaga, Arastanga Magga, you are a great Buddhist. You are on the direct path to Sotapanna.
Thank you, sir.
Venerable sir, can you hear me?
Yes, thank you. Yeah.
Yes, sir. This is a great opportunity to all of us as a counseling psychologist student at SIBA campus. We all learned how to apply mindfulness in day-to-day life and professional life, how to make positive impacts in our lives, and learn how life-changing benefits of physical, mental, spiritual, and interpersonal changing through your lecture, and special interesting facts about mindfulness in West and East, the basic idea about Satipatthana Sutta in the very beginning, and how to practice mindfulness while doing some practical meditation activities during the session also. We all experience that refreshness in our mind. This is a valuable opportunity for all of us at SIBA. Thank you very much, Thera, for your valuable time. And so thank you very much.
I think she summarized very well everything. Thank you, Peksha.
Dear sir. Dear sir.
Yeah, we can hear you.
Yeah. Dear Reverend Sir, dear our sir, Professor Sarath Chandrasekhara, thank you very much for giving this valuable, priceless opportunity, I think, for listening this mindful thoughtness discussion today, and your guidance to mindfulness also. So at the same time, giving our gratitude. On the other hand, I have a small question, sir. I want to know how to practice at homes with children at the same time in schools. Is there any special ways or means to practice mindfulness with children? How to keep on students' concentration of studies? If you have any message to give our school going children, yes, it is better, I think, sir.
No, sir. Thank you. Hello. Thank you very much, sir. I'm Fariha. Hello. Can you hear me, sir?
Yes, Pariha.
So thank you very much. I got a very good knowledge about the mindfulness, and I would like to thank our sir, Chandra, sir. Thank you for remembering me. Thank you very much again. Good night.
Thank you for sharing your experience and also your gratitude. Really appreciate it. Thank you.
Good evening, sir. I'm Delicia. I'm a Roman Catholic. Thank you for this great opportunity for knowing about MBSR and mindfulness. And thank you. Thank you so much.
You're very welcome, Delicia. Thank you very much, just listening to us and your appreciation. Really appreciate it. Thank you.
Okay, sir. Good night.
Good night.
I would also like to take this opportunity to show sincere gratitude. Actually, this session is really helpful for everyone, especially for the ones who think of being counselors one day. And also the facts you mentioned are really beneficial for everyone. And again, I would like to thank you for sharing this much knowledge with us, Saminu Hamza. Thank you.
You're very welcome, Kavi. Thank you very much for sharing your thoughts with us and your feedback. Really appreciate it. Thank you. I think there was another question that we didn't answer. Someone asked about how to apply mindfulness with children and schools, and also we don't have enough time to give you, the explanation and in details. But please contact Professor Sarat Chandra. I will be giving a talk to school teachers, and I will cover this subject, mindfulness in primary schools and mindfulness in secondary schools, and the UK experience, how we teach mindfulness in the United Kingdom. And I shared two practices we share with the children when they are really angry, when they are really upset, then how you are going to manage them, how you are going to be aware of their thoughts, feelings, and emotion, and how you are going to react to that. Rather reacting, we call it responding, but you can react in a mindful way, how you are going to react to them, not automatically, but also paying more attention with compassion and kindness. Okay, so I will be sharing some of the techniques with the teachers. So please contact Professor Chandrasekhar. He will give you some more details about this workshop for teachers. Thank you.
Thank you, Severan sir. Thank you.
I would like to convey my sincere thanks to Reverend Sir and Professor Sarat Chandrasekhar for organizing this valuable seminar. Thank you.
And I would like to invite Venerable Panyalo, our lecturer and coordinator of the Pali and Buddhist Studies Department, to say a few words. Venerable.
Thank you very much, sir, for inviting. Reverend sir, thank you very much for your wonderful lecture. Actually, I was unable to join the session because the Zoom had reached the maximum number of participants. So I was listening to your talk on Facebook, and fortunately, maybe 20 minutes ago, I could join the session. And I think this gave a real message to all our students, because when we also teach our students, we always remind them of being impartial. This is very important in terms of being religious people, being religious followers. We should be impartial, especially if you are a Buddhist. No matter whatever the religion you follow, it's very important for us to it is not important to label whatever we follow. What is important is giving the message. So I think our Venerable Sir's message was very clear and straightforward, and I think this is universal. That's why the teaching is universal. So if it is universal, anybody can follow. As Venerable Sir rightly mentioned, that if you try to label it, maybe there may be few followers, few students. But if you try to give it in a universal way or impartial way, there will be many followers and many students and many people getting the benefit of that. And I must say, sir, that I'm listening to you for the very first time, and I'm really impressed with your lecture. And I think thank you very much. I think all the students who joined today benefited a lot from your lecture, Reverend Sir. Thank you very much.
Thank you very much, Apehamduro, and really great to be here. I think my time was spent fruitfully, and thank you very much for feedback and the appreciation. and having me here today with you, your students. And I wish you good luck, good health, and happiness. May you be well, may you be happy. And whatever I can do for SIBA, for your development and teaching and learning strategies, I am here to help you and share my experience with you. Thank you. Teruvan Saranai Hamotama.
Yes, Subhashini is also there with representing our department. Subhashini, I invite you to say a few words. Okay. Varuni, are you there?
Yes, sir.
Varuni also. Yes, Varuni.
Yes, this is
She is
very.
representing the Department of Management Studies. Yes, Varuni.
Yes, thank you so much, sir, giving this opportunity for us. As a lecturer, I think I was have benefited from this session. Thank you very much, sir, and thank you so much, Professor, because this opportunity given for us also. Thank you so much.
You're welcome, and thank you very much, Teruvan Saranai.
I think already we have passed 11 minutes according to our time schedule. And so, Venerable Sir, thank you very much on behalf of the Sri Lanka International Buddhist Academy and Department of Counseling Psychology. I pay my gratitude to you and expending your valuable time for us. And now time also, I think, in a different in Sri Lanka and Scotland.
Yeah.
So now what is the time there?
It's quarter to 4, 3:42 in the afternoon.
Okay, so anyway, like I think we have to keep the connection in the future also. I think we can get more and more knowledge related to the mindfulness, and that is the term I think we'll be using in another 25 years to come, and always everybody will be using the mindfulness, sati, and see here. So that's very important, and therefore I really appreciate your lecture, and also very simple. Everybody is understanding. Some of them are calling me and say that, sir, please arrange another session also. So we are hoping to do that in the future also. On behalf of department, I really thank Varuni and also Kavindya and our Venerable Sir Viharagala Panyaloka, coordinator of the Pali and Buddhist Studies Department, and on behalf of our student, and also especially Gayani and Ramya, and then also Shalita, Aruna, and Kavindya, Pariya, and Delicia. All the students who have given their ideas and also give the gratitude, and thank you for you all. So may you be well and happy, and all the best for everybody. And so now we are going to conclude the. Thank you very much, Venerable Sir.
Teruvan Saranai Hamotama.
Teruvan Saranai.
Teruvan Saranai.